நிறைய பேர் வந்து ஐஜிகேர் ஃபார்மசிஸ்ட் எக்ஸாமோட சாம்பிள் கொஸ்டின் பேப்பர் ஃபார்மசிஸ்ட் எக்ஸாமோட கொஸ்டின் பேட்டர்ன் எப்படி இருக்கும் அப்படின்னு சொல்லிட்டு நிறைய பேர் கேட்டிருந்தீங்க. ஸோ ஐஜிகேர் ஃபார்மசிஸ்ட் எக்ஸாம் பொறுத்த வரைக்கும் பார்த்தீங்கன்னா நமக்கு சப்ஜெக்ட் பேப்பர், அதாவது ஃபார்மசி ரிலேட்டட் கொஸ்டின், ஃபார்மசியோட சப்ஜெக்ட் பேப்பர்லேருந்து 50 கொஸ்டின் 50 மார்க்ஸ் வரும். அண்ட் மேக்ஸ்லேருந்து 20, சயின்ஸ் 20 அண்ட் ஜென்ரல் அவேர்னஸ் 10. சரிங்களா? ஸோ இதில் 50 தான் வந்துட்டு கொஸ்டின் பேட்டர்ன் கொடுத்துருக்காங்க. ஸோ நம்மளுக்கு சப்ஜெக்ட் கொடுக்க வேண்டிய இம்பார்ட்டன்ஸ் ஜென்ரல் அவேர்னஸ், ஜென்ரல் கொஸ்டின்ஸ்க்கும் நம்ம ஈக்குவல் இம்பார்ட்டன்ஸ் கொடுக்கணும். ஓகே, இப்போ வந்துட்டு ஒரு ப்ரீவியஸ் இயர் சாம்பிள் கொஸ்டின் பேப்பர் சென்ட்ரல் கவர்மெண்ட் எக்ஸாமோட ஃபார்மசிஸ்ட் எக்ஸாம் கொஸ்டின் பேப்பர் தான் இப்போ வந்து நம்ம டிஸ்கஸ் பண்ண போகிறோம். ஓகே, கொஸ்டின் பார்க்கலாம். ஃபர்ஸ்ட் கொஸ்டின், தி ஸ்வீட்னிங் ஏஜென்ட் காமன்லி யூஸ்ட் இன் chewable tablet formula is sucrose, glycamate sodium, saccharine sodium, mannitol. The sweetening agent commonly used in chewable tablet formula is mannitol. Option D. Next question. Subcoating is given to the tablets to increase bulk, to avoid deterioration due to microbial attack, to prevent the solubility in acidic media, to avoid stickiness. Subcoating is given to the tablets to increase bulk. Option A. Next question. The pH of pharmaceutical buffer system can be calculated by pH partition theory, Noyes-Whitney law, Henderson-Hasselbalch equation, Michaelis-Menten equation. The pH of pharmaceutical buffer system can be calculated by option C, Henderson-Hasselbalch equation. Next question. The Pharmacy Council of India is constituted by the central government, state government, parliament, legislative assembly. The Pharmacy Council of India is constituted by the central government. Option A is the right answer. Next question. Poorly manufactured tablets may have small pinholes on the surface. This phenomenon is known as picking, mottling, leaching, cracking. Poorly manufactured tablets have small pinholes on the surface. This phenomenon is called option A, picking. Okay, next question. Among the following preparation, which one will be the most irritating to the eye? Purified water, 0.7% sodium chloride solution, 0.9% sodium chloride solution, 1% sodium chloride solution. The most irritating to the eye is option A, purified water. Next question. Bubble point test is done to determine the surface tension of the liquid in capillary tubes, the viscosity of the liquid in ampules, pH of a 1% solution, volume of a solution stored in a specific container. Bubble point test is used to determine option A, the surface tension of the liquid in capillary tubes. Okay, next question. As per good manufacturing practice, permitted limit of solid contents in water for injection is 100 parts per million, 1 parts per million, 0.1 parts per million, 10 parts per million. As per good manufacturing practices, permitted limit of solid content in water for injection is option D, 10 parts per million. Okay, next question. License for wholesale of drugs specified in Schedule C and C1 is issued in the form 20A, 20B, 21B, 22A. License for wholesale of drugs specified in Schedule C and C1 is issued in the form of option C, 21B. Next question. In capsules, rotofill is used for filling powders, pellets, liquids, corrosive liquids. In capsule, rotofill is used for filling option B, pellets. Next question. Which of the following commonly available large volume dextrose solution for intravenous use is isotonic? Which of the following commonly available large volume dextrose solution for intravenous use is isotonic? 2.5%, 5%, 10%, 20%. Correct answer is option B, 5%. Next question. Which is the ideal combination for testing the solubility of an entry coated capsule in alkaline medium? Option A, sodium bicarbonate plus potassium hydroxide plus pepsin, sodium bicarbonate plus sodium tauroglycolate plus papain, sodium bicarbonate plus pancreatine plus sodium tauroglycolate, sodium bicarbonate plus bilirubin. The ideal combination for testing the solubility of entry-coated capsule in alkaline medium is sodium bicarbonate plus pancreatine plus sodium tauroglycolate. Next question. Which one of the following is a pseudo-alkaloid? Caffeine, ephedrine, morphine, codeine. Caffeine, ephedrine, morphine, codeine. Which one of the following is a pseudo-alkaloid? Caffeine and ephedrine. Rendume correct answer. Okay. Next question. Which vitamin contains steroidal structure? Vitamin E, vitamin A, vitamin D, none of the above. Which vitamin contains steroidal structure? Correct answer is option D, vitamin D. Next question. Morphine is present in Atropa belladonna, Papaver somniferum, Ricinus communis, Solanum nigrum. Morphine is present in option B, Papaver somniferum. Next question. Emitin, an alkaloid of ipecacuanha, acts as antimalarial, antidiarrheal, antiseptic, amoebicide. Emitin, an alkaloid of ipecacuanha, acts as a amoebicide. Option D is the right answer. Next question. Patient with glucose 6-phosphate dehydrogenase deficiency is treated with dapsone. He will suffer from hemolytic anemia, perigneous anemia, diarrhea, none of the above. Patient with glucose 6-phosphate dehydrogenase deficiency who was treated with dapsone, he will suffer from option A, hemolytic anemia. Next question. Which one of the following drugs is not a long-acting benzodiazepine? Diazepam, clonazepam, flurazepam, midazolam. Which one of the following drugs is not a long-acting benzodiazepine? Option D, midazolam. Next question. Which antibiotic is used for the treatment of both tuberculosis as well as leprosy? Isoniazid, rifampicin, clofazimine, ethanolamide. Which antibiotic is used for the treatment of both tuberculosis as well as leprosy? Correct answer is option B, rifampicin. Next question. All the following are stimulant purgatives except bisacodyl, castor oil, senna, liquid paraffin. All the following are stimulant purgatives except option D, liquid paraffin. Next question. Mast cell stabilizer is salbutamol, theophylline, sodium chromoglycate, atropine. Mast cell stabilizer is option C, sodium chromoglycate. Next question. Anticholinergic used as a bronchodilator is pilocarpine, ipratropium, paracetin, salbutamol. Anticholinergic used as bronchodilator is option B, ipratropium. Next question. Mucolytes are bromohexane, carbocystine, acetylcysteine, all of the above. Mucolytes are bromohexane, carbocystine, acetylcysteine. Correct answer is option D, all of the above. Next question. All except dash are the antibiotics obtained from fungi. Penicillin, griseofluvin, cephalosporin, bacitracin. All except dash are antibiotics obtained from fungi. Option D, bacitracin. Next question. Some bacteria develop drug resistance very rapidly except Staphylococci, coliforms, Staphylococcus pyogenes, tubercular bacilli. Correct answer is option C, Streptococcus pyogenes. Next question. Clavulanic acid or sulbactam is used in combination with amoxicillin against H. influenzae because clavulanic acid inhibits beta-lactamase produced by H. influenzae. Clavulanic acid is acid-resistant antibiotic. Clavulanic acid is very susceptible to H. influenzae. None of the above. Correct answer is option A. Clavulanic acid inhibits beta-lactamase produced by H. influenzae. Next question. Second line anti-tubercular drug. Streptomycin, capreomycin, ethambutol, rifampicin. Second line anti-tubercular drug is option B, capreomycin. Next question. All first line TB drugs are bactericidal except isoniazid, rifampicin, ethambutol, pyrazinamide. All first line TB drugs are bactericidal except option C, ethambutol. Next question. All the following except dash contain imidazole ring. Clotrimazole, econazole, miconazole, ketoconazole. All the following except dash contain imidazole ring. Option D, ketoconazole. Next question. In congestive cardiac failure, digitalis glycosides are used because it increases heart rate, force of myocardial contraction, venous pressure, cardiac filling pressure. In congestive cardiac failure, digitalis glycosides are used because it increases force of myocardial contraction. Option B is the correct answer. Next question. In order to produce characteristic pharmacological action, a drug must always reach high blood levels, absorb the gastrointestinal tract readily, achieve adequate concentration at the site of action, excreted unchanged in urine. In order to produce characteristic pharmacological action, a drug must always achieve adequate concentration at the site of action. Next question. Heparin prevents blood coagulation by inhibiting thrombin catalyzed conversion of fibrogen to fibrin, precipitate blood calcium, thereby prevent coagulation reaction, inhibiting enzyme reactions, converting ionized calcium by chelation. Heparin prevents blood coagulation by inhibiting thrombin catalyzed conversion of fibrinogen to fibrin. Option A is the right answer. Next question. Which is an anti-metabolite? Fluorosil, nitrogen mustard, cyclophosphamide, chlorambucil. Which is an anti-metabolite? Option A, fluorosil. Next question. Selective beta-2 bronchodilator used for the treatment of status asthmaticus is acetylcholine, isoethyrene, tetrabutylene, dirabuterol. Selective beta-2 bronchodilator used for the treatment of status asthmaticus is option C, tetrabutylene. Next question. Belladonna alkaloid atropine is used prior to administration of general anesthetic agent due to inhibition of GIT motility, prevention of meiosis, inhibition of salivation and secretion of respiratory tract, causing skeletal muscle relaxation. Belladonna alkaloid is used prior to the administration of general anesthetic agent due to its inhibition of salivation and secretion of respiratory tract. Option C is the correct answer. Next question. Drug of choice in amoebic dysentery is penicillin G, niraparib, metronidazole, tetracycline. Drug of choice in amoebic dysentery is option C, metronidazole. Okay. Next question. clinically used uricosuric agent is diazepam, sulfonapyrazole, phenylbutazone, phenytoin. Correct answer is clinically used uricosuric agent is option B, sulfonapyrazole. Next question. The metal used in the treatment of rheumatoid arthritis is silver, gold, copper, antimony. The metal used in the treatment of rheumatoid arthritis is option B, gold. Next question. The drug very effective in the treatment of acute gout is aspirin, acetaminophen, phenylbutazone, indomethacin. The drug very effective in the treatment of acute gout is option D, indomethacin. Next question. The anti-tubercular drug inhibiting RNA synthesis streptomycin, ethambutol, chloramphenicol, rifampicin. The anti-tubercular drug inhibiting RNA synthesis is option D, rifampicin. Next question. The anti-tubercular drug inhibiting protein synthesis which potentially for ototoxic effect is the anti-tubercular drug inhibiting protein synthesis with potential for ototoxic effect is ethambutol, dapsone, streptomycin, isoniazid. Option C, streptomycin. Next question. Methotrexate is an antagonist of cobalamin, folic acid, riboflavin, tocopherol. Methotrexate is an antagonist of option B, folic acid. Next question. All are the side effects of chloroquine except blurring of vision, hemolytic anemia, psychotic episodes, skin rash. All are the side effects of chloroquine except option B, hemolytic anemia. Next question. Antidote for organophosphorus poisoning is nitrous oxide, atenolol, atropine, tubercularine. Antidote for organophosphorus poisoning is option C, atropine. Which of the following agents is a choline esterase reactivator? Aspirin, pilocarpine, scopolamine, paralodoxamine. Which of the following agent is a choline esterase reactivator? Option D, paralodoxamine. Next question. Drug of choice in the treatment of cardiogenic shock is. Drug of choice in the treatment of cardiogenic shock is. Option C, dopamine. Next question. The choice of drug to treat cerebral malaria is. The choice of drug to treat cerebral malaria is option C, quinine. Next question. All of the following statements concerning sulfonamides are correct except inhibit dihydrofolate reductase, crystalluria may occur, they are antimetabolites of PABA, they are bacteriostatic. All of the following statements concerning sulfonamides are correct except option A, inhibit dihydrofolate reductase. Next question. Optic neuritis is a chief adverse effect of sulfur drugs, pyrazinamide, rifampicin, ethambutol. Optic neuritis is a chief adverse effect of option D, ethambutol. Which of the following is not a macrolide antibiotic? Erythromycin, spiramycin, olendomycin, vancomycin. Which of the following is not a macrolide antibiotic? Option D, vancomycin. Next question. A steroidal antibiotic is fusidin, bacitracin, aminophylline, clindamycin. A steroidal antibiotic is option A, fusidin. Next question. The preferred treatment of status epilepticus is intravenous administration of ethoxamide, sodium valproate, diazepam, chloramphenicol. The preferred treatment of status epilepticus icticus is intravenous administration of option C. Next question. Bromocriptine is used to treat amenorrhea because it suppresses the prolactin releases. Bromocriptine is used to treat amenorrhea because it suppresses the prolactin release. Next question. The primary mechanism of action of local anesthetic is the blockade of. The primary mechanism of action of local anesthetic is the blockade of potassium channel, calcium channel, sodium channel, all of the above. The primary mechanism of action of local anesthetic is the blockade of option C, sodium channel. Next question. Long-term use of glucocorticoids induce hypotension, hepatotoxicity, osteoporosis, bradycardia. Long-term use of glucocorticoids induce option C, osteoporosis. Next question. Clomiphene is used to treat infertility because it stimulates LH secretion, follicular development, ovulation, uterus activity. Clomiphene is used to treat infertility because it stimulates ovulation. Option C is the right answer. Next question. Isoxazoline is used to treat asthma, severe hypotension, nasal congestion, premature labor. Isoxazoline is used to treat option D, premature labor. Next question. The phenomenon of invasion and destruction of tissue is known as natural immunity, acquired immunity, pathogenicity, parasitism. The phenomenon of invasion and destruction of tissues is known as option C, pathogenicity. Next question. Organisms that can grow on organic matter from dead plants or animals are called as saprophytes, parasites, psychotropes, mesophils. Organisms that can grow on organic matter from dead plants or animals are called as option A, saprophytes. Next question. Glycerol may be used as a preservative in a percentage of 15, 50, 1, 0.1. Glycerol may be used as a preservative in the percentage of 50. Option B is the right answer. Next question. The microorganism that can enter the body only through an injury is Salmonella typhi, Clostridium tetani, Clostridium botulinum, Streptococcus pyogenes. The microorganism that can enter the body only through an injury is option B, Clostridium tetani. Next question. TS contain an antibacterial enzyme known as zymase, diastase, lysozyme, lipase. TS contain an antibacterial enzyme known as option C, lysozyme. Next question. Protein deficiency disease is known as Cushing's disease, Fabry's disease, Parkinson's disease, Kawashkar and marasmus. Protein deficiency disease is known as option D, Kawashkar and marasmus. Glycogen is present in all body tissue except liver, brain, kidney, stomach. Glycogen is present in all body tissue except option B, brain. Next question. The conversion of carotenoids to vitamin A takes place in. The conversion of carotenoids to vitamin A takes place in intestine, liver, kidney, skin. Conversion of carotenoids to vitamin A takes place in option A, intestine. Next question. The precursor of bile salts, sex hormones and vitamin D is. The precursor of bile salts, sex hormones and vitamin D is cholesterol. Option B, cholesterol is the right answer. Next question. International Enzyme Commission classifies enzymes into Option B, 6 classes. International Enzyme Commission classifies enzymes into 6 classes. Next question. Platelets contain an enzyme which has an important role in clotting of blood. This enzyme is known as Platelet contain an enzyme which has an important role in clotting of blood. This enzyme is thrombokinase. Option D, thrombokinase. Next question. Cobalt is a constituent of folic acid, vitamin B12, niacin, biotin. Cobalt is a constituent of option B, vitamin B12. Next question. In the process of transcription, the flow of genetic information is from DNA to DNA, DNA to protein, DNA to RNA, RNA to DNA. In process of transcription, the flow of genetic information is from option C, DNA to RNA. Okay. Next question. Milk is deficient in which mineral? Milk is deficient in which mineral? Phosphorus, sodium, iron, potassium. Milk is deficient in option C, iron. Milk is deficiency in iron. Next question. Unopened insulin is stored at -1 to -5 degrees Celsius, 2 to 8 degrees Celsius, 15 to 20 degrees Celsius, 20 to 30 degrees Celsius. Unopened insulin is stored at option B, 2 to 8 degrees Celsius. Next question. Glargine is short-acting insulin, intermediate-acting insulin, peakless insulin, oral insulin. Glargine is option C, peakless insulin. Okay. Next question. Metformin is sulfonylurea, DPP4 inhibitor, biguanide, alpha glucosidase inhibitor. Metformin is a option C, biguanide. Metformin is a biguanide. Enalapril is a angiotensin receptor blocker, calcium channel blocker, beta blocker, angiotensin converting enzyme inhibitor. Enalapril is a angiotensin converting enzyme inhibitor. Option D is the right answer. Next question. In primary vaccination, DPT is given as 3 doses at 1 month intervals, 3 doses at 3 month intervals, 5 doses at 1 month interval, single dose. In primary vaccination, DPT is given as 3 doses at 1 month intervals. Next question. The following are NSAIDs except ibuprofen, diclofenac sodium, ketotifen, piroxicam. The following are NSAIDs except option C, ketotifen. Next question. Dextromethorphan is used in cough syrup as expectorant, mucolytic, bronchodilator, suppressant. Dextromethorphan is used in cough syrups as option D, suppressant. Next question. The following are proton pump inhibitors except omeprazole, rabeprazole, pantoprazole, albendazole. Following are proton pump inhibitors except option D, albendazole. Next question. The following are true of National Pharmaceutical Pricing Authority except it is a statutory body. It can fund studies regarding pricing of drug. It monitors drug shortages and takes place appropriate action to rectify it. It collects and maintains data regarding the import and export of drugs. The following are true to National Pharmaceutical Pricing Authority except it is a statutory body. Option A is the right answer.